Hello everyone. Today, we are diving deep into the domain of a medication called Sumatriptan. As with all our sessions, this discussion is purely for educational enlightenment. Always ensure you consult a medical professional if you have any health-related concerns or questions. Description: Sumatriptan, which might be identified by its brand names such as Imitrex, Onzetra Xsail, and others, is an oral, nasal, subcutaneous injection, or a nasal powder drug that belongs to the class of medications called triptans. It is primarily designed to treat migraines and cluster headaches. Sumatriptan works by narrowing the blood vessels around the brain and also reduces substances in the body that can trigger headache pain, nausea, sensitivity to light and sound, and other migraine symptoms. This medication is specifically tailored for those who have been diagnosed with these conditions and is not used for routine headache or any headache that seems different from your usual migraine headaches. Warnings: Sumatriptan has certain precautions attached to it. It should not be taken if you have any history of heart diseases, a stroke or TIA, transient ischemic attack, Wolff-Parkinson-White syndrome, or circulation problems that cause a lack of blood supply within the body. Additionally, it's not recommended for those with uncontrolled high blood pressure, severe liver disease, or if you have taken an MAO inhibitor in the past 14 days. Before taking this medicine. Before you start on Sumatriptan, it's vital to discuss your entire medical history with your healthcare provider. Make them aware if you have liver or kidney diseases, epilepsy, or other seizure disorders, or risk factors for coronary artery disease, such as diabetes, menopause, smoking, being overweight, having high blood pressure or high cholesterol, having a family history of coronary artery disease, or being older than 40 and a man. If you are pregnant, plan to become pregnant, or are breastfeeding, ensure you discuss the potential risks and benefits with your doctor. Side effects: like all drugs, Sumatriptan may have potential side effects. Users might experience sensations of burning, warmth, redness, numbness, or tingling. Some might suffer from drowsiness or feelings of tiredness. Serious side effects include sudden and severe stomach pain, bloody diarrhea, seizure, convulsions, changes in the color or appearance of fingers or toes, and symptoms of a stroke. Additionally, there are symptoms indicative of higher serotonin levels in the body, like hallucinations, fever, muscle stiffness, and rapid heart rate. If any unusual symptoms emerge, it is imperative to consult your healthcare provider promptly. Interactions: Sumatriptan can interact with other medications. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently ingesting to evade potential harmful interactions. Dosage: adhering to the correct dosage is paramount for the efficacy of any medication. Always follow your doctor's guidelines when consuming Sumatriptan. The specific dosage and method, oral, nasal, or subcutaneous injection, depend on the severity and type of headache and the patient's response to the medication. For detailed dosage instructions, it's best to refer to the prescription label or consult your healthcare provider. Always ensure that you are taking the proper dose and never modify your dosage without discussing it with your healthcare provider first. Avoid: while on Sumatriptan, avoid drinking alcohol as it might cause adverse side effects or worsen your headache. As this medicine can impair your reactions, it's wise to avoid driving or hazardous activities until you know how the medicine affects you. FAQ: a common query is regarding age restrictions for Sumatriptan. Currently, Sumatriptan is not recommended for use in patients under 18 years or over 65 years due to a lack of data on safety and effectiveness. Always consult a healthcare provider for specific concerns about this medication. Closing: that brings our discussion on Sumatriptan to a close. Remember, the purpose of this script is to provide knowledge and should never be a substitute for professional medical counsel. Always confer with a healthcare provider for any doubts or worries. Thank you for joining us.